Everyone, and welcome to our second session for the Lunch and Learn series, Summer 2022. Today, we have a talk called The Impact of COVID-19, A Holistic Perspective. And we have Dr. Washington today with us. A native of Charleston, South Carolina, Dr. Georgetta Washington has been a member of the Johnson City community since 1987 and has recently retired as a professional registered nurse and educator for 40 years. Dr. Washington earned her Bachelor's of Science in Nursing from Clemson University, her Master's of Science in Nursing from Medical University of South Carolina, and her Doctor of Philosophy in Nursing from ETSU. She also earned a Master's of Arts degree in Christian Ministry from Emmanuel Christian Seminary at Milligan College, Milligan, Tennessee. The majority of her career has been in critical care and in nursing education, both in the clinical area as well as in academia. She was previously employed at Wellmont Health System and Mountain State Health Alliance prior to the Ballad merger. Dr. Washington has taught pathophysiology for all traditional LPN and BSN first semester nursing students at ETSU from fall 2016 through fall 2020. She has taught communication courses for nursing students as well as in the interprofessional education program. In December 2020, Dr. Washington completed requirements to become a licensed minister of the gospel and serves at Thankful Baptist Church as a member of the ministry leadership team. Come August 2023, she will be an 18-year breast cancer survivor who is grateful to God for every birthday, especially those since her diagnosis in 2003. Thank you for being with us today, Dr. Washington.
Guess it'll work better if I were to unmute myself. Good afternoon, everyone, and thank you for the opportunity for being here, and thank you for the opportunity of talking about this subject, which we have all lived with since for almost 3 years now. It seems like it's been forever. It seems like it's always been with us, and I'm afraid it might be with us for a little while longer. I once had a student that said that in my patho class, it said that patho made her laugh and cry. And so as I was preparing for this topic, it was both enlightening and painful. So I'm going to go ahead and share my screen and we will get started. Okay, here we go. Okay. Like I said, the student said that patho made her both laugh and cry. And this preparing for this was rather enlightening, simply because I just did not know how much information that had been gathered on this topic from my holistic perspective since we had been in this worldwide pandemic. So what I propose is that we do what I'd call a 35,000 foot view. And as you can see this picture from the airplane, it's kind of cloudy and very limited details. But you also have another I have another picture here with less cloud. You have a few more details, but you still can't exactly find an address on the street below, so to speak, or even know where you might be at the time. So we're going to take this high level view, if you would, of what I call the holistic perspective. Now, when Dr. Johnson assigned me this topic, my first thought was to treat it like a research study, in that you have to read the literature in order to find out what literature you need to read when you are about to work on your research question. And so as I found this picture, if you would, just online, and it talks about the topic and then the working knowledge of the topic and then questions and then general questions and then research questions, I determined that what I was going for was a working knowledge of the topic, if you would. So like those signs you might see in the mall, you are here at this level on the pyramid. When I decided to try to take a different slant, if you would, on this and looking at a holistic view, we've had almost 3 years of numbers and physical factors to look at and to have given to us, so to speak. And so I wanted to, again, step back and take a broader view, a more complete view, if you would, of COVID's impact. Now, the physical impact was the obvious first concern because that's where it was hitting us. People were dying and dying quickly and dying in large numbers. And so the other factors that impact or cause an influence or an impact kind of evolved over time. And so we're looking in this holistic kind of perspective. We're looking at not just the body, but the mind and the spirit. And we're also looking at the environment, and that's both the internal and the external environment, to look at just how COVID has impacted us. So like any true researcher, I wanted to look and see if I could find out what was already out there or what was out there. And I quickly became overwhelmed because you can see it's just doing your generic Google search. I got more than 3.5 billion hits. And I thought, well, there's no way I'm going to be able to wind my way through all of those. And so I did a lit search there. I did use Google Scholar and got 3 million scholarly articles. And I thought, well, that's just still a little bit too much to try to wind my way through. I have CINAHL here quickly available to me, and I found 6,000 articles there. And so it's just, again, I just got overwhelmingly overwhelmed. And that's just using one search strategy. And I put in the title, The Impact of COVID. And so, I just, if I had used any other words, any other search strategies, I would just be amazed, I'm sure, at the number of information that I have found. So I thought maybe if we look at categories, how it's impacted globally, how it's impacted just in the United States, regionally, state-wise, and locally, I still found this a bit overwhelming. And so, I'd ask that you think about your place in any of these categories. Something probably has affected you as individuals in each one of these categories. And so that, again, was still overwhelming there. So I looked at a couple of other sources. And so I want to start with the impact, the human impact in numbers, because again, I'm not going to spend a whole lot of time there, but this is where we've had the majority of our information from for the past almost 3 years. And so I've taken numbers from Dr. Randy Wyckoff's College of Public Health updates that he's been giving, and these have been very helpful, along with numbers from the CDC that have also been very helpful. So today, our total cases worldwide, 88,056,795. You see there, patients, total cases there. Worldwide deaths, a little bit more than 6 million deaths, with about 1,350 occurring on a daily basis. In the United States, we've topped more than 1 million deaths and about 260 of these happening daily. And in Tennessee, we've had about 26,000 deaths from COVID. The numbers of the people who have been vaccinated, as you can see in the United States, about 67%. About just a little bit less, there's a smidge less than 50% have had that first booster shot. Almost a third of the population has had that second booster shot. And then currently, as of July 4th here, we've got 30,000 people, almost 31,000 people in the United States who are hospitalized. And in Tennessee, we've got about 613 that are hospitalized. Now, this is just a snapshot, and I don't give any information, what we look like before, over time, to have you do any comparisons, because I feel like we've seen those, we've been there. So I just wanted to give a snapshot of of where we are today. Now, the College of Public Health numbers are as of June 30th. And like I said, the CDC numbers are as of July 4th. I did find it interesting, though. Today is Tuesday. I think on Saturday of this past week, and then last Wednesday, I think, of the past week, I had reason to go on the CDC website to look and see our areas where our area's risk was. Washington County had been at low risk. And so, not really recommending unless, an individual wanted to, wearing masks out and about for a while. But last Wednesday, I think it was, we were back up to high risk. But last Saturday, we were back down to medium risk. And so, unless a body is checking that site on a daily basis, folks are just going to have to decide what they're going to do based on the information that they're getting, perhaps in the news or during their own search. So things are certainly shifting. It seems like the numbers are going down, if you would, of cases and of deaths. We did have a spell there where Dr. Wyckoff said that the hospitalizations were going up. And usually after hospitalizations, you saw an increase in deaths when that was not happening, which in itself is a good thing, because that means that you've got serious illnesses, but not serious enough to lead to death like we've been having before. So as we look at those numbers of the number of people vaccinated, and I'm sure they're changing, hopefully they're changing, this looks like a good thing. So in looking at this holistic perspective, I thought what I would use is the categories that I did find that I thought was really good. In one actually letter to the editor, was looking at the impact of COVID on healthcare, the impact on economics, and then the social impact also. So as we look at healthcare, there have certainly been challenges, particularly in the beginning with diagnosis, because we didn't know really how folks got it, how the virus entered the body. There were challenges with quarantine and challenges with isolation, just getting the definition of those two terms correct so that you were doing the correct thing for the correct reason. And then certainly challenges with treatment because, well, there was none for this new novel virus that we had never seen before. We had instances where as patients got sick and were hospitalized, family members could not come and see them. So we had this first time of mass quantities, if you would, of not only deaths, but people dying alone. And that just doesn't happen on this level in the United States. We put value on if, especially if you know a death is imminent, of having family around. And this could not happen in these instances. So there was that impact on the psyche of we couldn't be with that loved one as they transitioned. And then there were some practical things like the high burden that was placed on the healthcare system that we found out. Things like limited and depleted blood supply. For the trauma patient that was still going to be an issue in the middle of the pandemic, we had less and less or fewer and fewer people who were willing, able, or even recommended to come into donor centers to give blood. And so those patients may have been impacted. And then we had the disparities that just came to light even more so than others. We had the disparities when we looked at the different people groups who tended to contract COVID more readily and at higher numbers than other folks. And we could see it was the people who couldn't stay home, the people who had occupations that did not allow them to work from home. These were also the people we determined were essential to keeping our society and our community, our country running. Not everyone could just stop. Some things had to continue on. So all of those disparities kind of got in our face, as I would say, at that time. And then we had issues with lack of space for people with other conditions, for folks who had things other than COVID, because we were so overrun, if you would, quite literally with those COVID patients. There was a need to take up space from other patient care areas and turn them into COVID units, because we had so many patients who had COVID. We didn't have a space to put the person who had the heart attack. We didn't have a space to put the person who was having an exacerbation of their COPD. We didn't have space to put folks who were having other issues. And then, the high burden also continued because along with the creation of those COVID units, now you've got to have staff who could take care of those patients, which means you're pulling staff from taking care of other patients as well. And so those daily kinds of issues with staffing, which have always been there, but they were more and more uncovered during this pandemic. We had issues with patients with other health problems being neglected. There were, follow-ups for other conditions may have not happened because of fear, if you would, of going into a facility anywhere, whether it was a hospital or a physician's office. And so there was a neglect to follow up for other conditions there. But as a side note, then we had an increase in telehealth, which may have made some of this a little bit more feasible to be able to do. The healthcare workers, were getting weary because not just physically, but emotionally and mentally. And I don't know if there's ever been a time where it's been that much of a emotional and physical toll taken on caregivers. I can remember thinking with my background in critical care that even I haven't seen everything that I have seen in taking care of critically ill patients. Even I could not imagine going to work every single day and knowing without a doubt I would be putting at least one person in a body bag and sending them to maybe not the morgue, maybe to a makeshift morgue. I cannot imagine knowing that and going to work every day, knowing that one of, if not both of those things were going to happen. We would not imagine that there would be so many people who would be in such denial for several reasons that as they were dying of COVID, would declare they didn't have COVID. Again, in many years of taking care of patients, there's been very few people who have been denying that they are actually a newly diagnosed diabetic. You'd have some of those who were just trying to take in the information, but so many patients and families who would still deny that they actually had the disease. We've never seen, I don't think, the services shut down, okay? Healthcare services shut down. Again, myself, I had a lens, cataract removal and lens implant scheduled for Wednesday, March 18th. And all elective services were shut down on Friday, March 20th. And so I was certainly glad that I got in under the wire, because while it may have been elective and non-essential in the bigger scheme of things, I needed to see better. And so I was glad I was able to get in under the wire with that. We had one member of my church who had to put off a hip replacement for more than a year because all of the resources were being consumed, if you would, a majority of the resources were being used by those having COVID and needing to take care of those having COVID. The good thing about that is that her hip wasn't very, very, very bad. It was annoying. It wasn't very painful. She could still get around. And so that year's wait wasn't very painful for her. Some other issues that happened as far as healthcare is delaying in mammograms, delayed screenings. And then, for example, mammograms, delayed screenings could lead to delayed diagnosis, which could lead to delayed treatments. And so, I've not looked, perhaps an epidemiologist out there, could look and see, just how many, what happened to was there an increase in cancer diagnoses during this time? Was there an increase in deaths or metastasis from cancer. Specifically, we're talking about mammograms from breast cancer because of delayed screenings, which again may have led to delayed diagnoses, which may have led to delayed treatments. My dental hygienist canceled our appointments because they were considered not essential. But think about someone who may have had some type of periodontal disease, some type of gum disease. How did that impact them? They may have been in treatment. They may have just begun to do an assessment to see if they had and how bad their periodontal disease was. But at least for my general dentist, our routine cleanings were canceled, and they were asked to donate their PPE, their personal protective equipment, to the cause, to the acute care facilities to be used by healthcare professionals for taking care of COVID patients. And then again, breast cancer survivor, I had an annual follow-up appointment with my surgeon. I got to thinking in May of 2020, I don't know if I want to go sit in an office with folks who may or may not, have been exposed to COVID. And so I didn't call for an appointment, and they didn't call to remind me of the appointment. So maybe they were thinking the same things either. And I think, even if I had called, they may have said, it's just an annual follow-up. There's no need to expose yourself unnecessarily. So they may not have even accepted making an appointment. But those kinds of things, again, impacted healthcare in ways we never would have imagined. You had nurses making their own PPE because of the interruption and the overwhelming need for more PPE. We were using it faster than it could be made and faster than it could be delivered. And so there was that disruption in the medical supply chain there. Your own Dr. Johnson, his department made face shields for the College of Nursing, for the students in the College of Nursing, because our clinicals out into the facilities continued after a minute, but those clinicals continued. And so you had the inability to buy, purchase, find PPE. And so Dr. Johnson's department made face shields for the College of Nursing. And then we have an expectation, I think the general public did, that with the vaccine, once it finally got here, everything would be well. And we forget that the vaccine just helped with severe disease. No vaccine is 100%. And I think folks forgot that. And so folks who got, even after the vaccine, folks may have still contracted the virus. Some folks have had it several times, okay? And they've had all the vaccine juice that they can get. And they still contracted it. So I think that kind of takes a toll also, and brings up questions that a healthcare professional may get from their patients. And now we also have, because again, we're almost 3 years into this, what are these long-lasting effects? These long-lasting health effects, and not just on those who have other conditions going on, but on healthy folks who were otherwise healthy are having different long-term effects. And we don't know, simply because we are in the moment. We don't know, what those effects will be, how long they will last, what kind of impact is this going to have on the person with heart disease, or the person who is diabetic. And so you can almost understand some lasting effects on those who weren't so healthy to begin with. But folks who are otherwise healthy are also having some issues also. And then we hear about and we see this exodus of healthcare professionals from the profession. And again, being a registered nurse, we've got nurses, quote unquote, leaving left and right simply because they're burnt out. They have been overwhelmed. They've seen things that no one person should have to see. They have been in conditions in situations that no one person should have to deal with. And they're still dealing with folks who either don't believe or doubt the research that's out there, or the treatments that are out there, and they just have plain old COVID fatigue, whether they've contracted COVID themselves or not. They just have the fatigue from dealing with it. And so we have an impact on healthcare that I don't think we could have foreseen. We may have been able to foresee, not enough room to put patients. Okay. We may have been able to foresee, not enough equipment. Maybe we didn't do a good job of either one of those. But again, delayed screenings, having to cancel appointments, cancel things, lack of PPE, those things we probably could not have seen. Okay, so healthcare. And so now I'll move on to economics. What did this do to our collective pocketbooks, if you would? We saw a slowed manufacturing of essential goods. And along with a slowed manufacturing, we saw an increased use, because I'm sure everybody remembers the run on the toilet paper that happened, toilet paper and sanitizer. And could not ever in my wildest imagination think that you would go into any store, every store, and find such empty shelves for those where those paper goods used to be. And I could not figure out why the run on toilet paper. But then a colleague and I were talking, and we were thinking, well, think about it. The world has shut down, come to a halt. Everybody has gone home. You've got families who are under the same roof all day long in ways that they haven't been in a very long time. Well, yeah, we're going to need more toilet paper. And so you've got this again, just overall slowed manufacturing of what we come to find are essential goods. A disruption of supply chain of products. And not only, we may not have seen that because the general person didn't see this pandemic coming. But not only was it disrupted at the beginning, but we have some level of disruption now. We continue to have empty shelves or delayed restocking of shelves of certain items. And it just seems like everything I want, I have a hard time finding, but I'm sure everybody is experiencing that. And so we had lost jobs because businesses shut down. Who would imagine that the world would have come to a screeching halt like it did? And so, we had lost jobs because businesses had to close. And these people who were working there, they no longer had a source of income. There were some businesses who did the best that they can, for as long as they could for some of their employees. So you had the issues with lost wages, which then led to an overwhelming, if you would, of our unemployment system. You had to have people on the other side of that computer or that phone to process all of these requests. And so the process got bogged down and folks got lost in that, got lost in that process. So you had those lost wages and then issues with the unemployment funds. Even if you got through, how long did it take for those funds to come through? We discovered in a big way who an essential worker was, or what an essential worker was. It was the truck driver. It was the person, the grocery store clerk. It was the folks who were the most vulnerable because these jobs could not be done from home. The minimum wage workers, folks, those who probably had little to no insurance, they were at the highest risk, but yet being exposed. But yet, if they did get exposed, they were again at the highest risk of not being able to pay for the treatments that might be necessary. We found out in a big way that we had a lack of preparedness for a pandemic. And so a country as rich in many different ways as we seem to be floundering, if you would, as these all of these issues and challenges came upon us and impacted us. Even at ETSU, on an educational level, which I'm sure impacted universities all over the place, just like we saw in our primary and secondary educations, how nimble those teachers had to be in order to get their information to their students. But at a university level, when we went home, so to speak, I know just in my class, I lost 3 students who had to drop out because where they were going home to, they had either a lack of internet, lack of dedicated space for class, or they had no hardware. When I think of how many students had to borrow a computer to take their exams, and otherwise, when they were in class, they were handwriting their notes. Okay, so and then I think about the impact that this may have had on their scholarships. Were their scholarships put on hold because they had to withdraw? Because most scholarships require that you have continual enrollment along with attendance and grade requirements. So did they lose scholarships, or were their scholarships put on hold for when they could get back into school? You had areas of research that were changed. And when you think about some of our research universities, who get lots of dollars, bring in lots of dollars from NIH, for example, to do research. Once graduate student's dissertation had data gathering had to go from face-to-face interviews to telephone and Zoom interviews. Well, that may have seriously impacted the numbers of subjects that she had. Were they able to get to the telephone? Could they do Zoom? And then you have the challenge of teaching from home. Okay. And maybe not being prepared, and economics coming here too. I had to buy a new laptop in order to continue teaching at home. I discovered my 6-year-old laptop just couldn't do what I needed it to do. And so one midnight after class, I'm hitting the send button to buy a new laptop, hoping it would get there before class the next week, because my current laptop just wasn't going to do it one more time. And then we think of what's essentially lost revenue for the university, trying to provide what students needed at home, up to and including hardware, developing hotspots around, if they could just get to campus, and use the hotspots, having to supply Zoom accounts for every student, and having to do all this technology that no one could see coming or had planned for, without the tech fees that would have ordinarily been assessed, if you would, because none of this was supposed to be online classes. And so, there was a lot of lost revenue there. You think of the food vendors that on campus that, had nobody to feed, and probably had trouble getting supplies there also. So you had a lot of economic issues going on there. Again, you had a loss of both national and international businesses, poor cash flow because nobody was out there doing anything. A lot of things were happening online, but not like I just run out to the grocery store and get whatever. Okay, because I wasn't going to the grocery store unless I absolutely had to. And if you've all seen the signs, is it asking you to pay for your groceries with the exact change because there's a lack of coins. And I did not really investigate this or not, but if I'm not spending money, if I'm doing all my spending over online, then there's not a lot of cash being passed back and forth. And if I'm just not spending as much, period, there's not a lot of cash being passed back and forth. And they may have slowed down the manufacturing of coins because of that. And so now there you find signs all over the place asking for exact change, if you would, because of the lack of coins. And all of this led to a very, very significant slowing of revenue, simply because folks weren't able or sometimes willing, to get out there and share their funds with everyone else. So we've looked at healthcare and we've looked at impact on economics. There are quite a few, I think, social impacts also. You see issues with, as we see here, the service sector being unable to provide their services properly, simply because you had a lack of people to do the work. And I just had remembered another thing when we talk about the economic piece of it. We've got lost job and lost wages, but now we see we are in a time when there's not enough people in the labor force. And we go back and forth between, is this because of all the assistance that's being given and folks are just sitting back and taking the money? Or is it because of more self-employment? A lot of people, I did check into this, a lot of people have used this pandemic as a time to do that thing, start that small business that they have always wanted to start. And so, just off the top of my head, I hear advertisements for Shopify and Etsy, okay, where you can do those kinds of things online. But I did look and see in 2020, there were 4.4 million new business applications, small business applications. 2020, 4.4. 2021, there was 5.5 million small business applications. In 2020, there was 31 or 32 million small businesses. 2022, we have 33 million small businesses. So these are folks, I think may have taken the opportunity to do that thing that they have really maybe been wanting to do for a long time and never really had the reason or the courage to do it. But once you've lost your job and you've got to find an income somewhere, perhaps they have taken this opportunity, especially as we try to rebound to develop that small business. So that might be a couple of reasons why we're having a problem with labor shortages there. All right, so back to social here. Again, you've got the service sector, for lack of people to do the work now for various reasons who are unable to provide their services. And I think we've had some very eye-opening revelations about our society and what some folks call important. We have all, I think, learned what we can do without. I think we have all learned what the difference between a want and a need, perhaps. We have seen the cancellation of and postponement of large-scale sports activities and opportunities. Our very own basketball Bucks won the SoCon tournament and got the automatic bid to the NAAC tournament and were unable to attend, were unable to go because it got canceled. We have also had seen issues with travel being disrupted both nationally and internationally. You've had countries that have been closed, airlines that have shut down or continued to fly empty. Those folks that could go or were willing to go anywhere, which then put that industry in trouble, so to speak, also, and those employees. We've seen both cultural, religious, and festive celebrations canceled right here locally. The Blue Plum Festival, the Umoja Festival, 4th of July fireworks just came back again this year. The Christmas parade, all of those things had been canceled before. And along with faith traditions, we've seen teachings about COVID that have gone across the spectrum from one end to the other. I've seen the saying, faith over fear. Exactly what does that mean? Do we ignore the science and the research and put our trust in this higher being, or do we temper both of those with some common sense? Yes, God can do many things, but he could also use people to do them through. So we've seen lively discussions, if you would, in our faith traditions, our faith community also. We've seen an uncovering, if you would, of a more of a value, if you would, on personal freedoms as opposed to community responsibility. I can personally decide whether or not to wear a mask, or I may not want to wear a mask, but I'm going to do so for the person next to me. So we've seen some individualism versus community issues come about, taking care of self versus taking care of others. Those of you who may, had the challenge of teaching from home, you had to be mindful of what the students were going through, but you also needed to be mindful what you as an individual was going through in all of this also. Everybody was affected in different ways, but everyone was affected. So, taking care of self versus caring for others came in there also. You had increases in families being separated, not being able to travel, to see each other, to spend holidays, birthdays, any other traditional values together. I myself, I was unable to touch my adult children for 18 months. We spent time FaceTiming once we finally figured out we could do that, FaceTiming about once a week, just so we could stay in contact with each other. But it was 18 months before we could actually hug each other. And so, that caused an increased stress on the population. Socially, we also saw how both the virus and the vaccine was politicized. And, even to the point that those who did get the virus or did get the vaccine, that was politicized, or didn't, that was politicized. And I like to think of I don't like to think, but I think of 2020 as the year when the world exploded and imploded at the same time. Because not only did we have the virus, it was compounded by the murder of George Floyd, and we had a very contentious presidential election happening at the same. Those three things, it was like it just kept piling on. It just kept piling on, and each one by itself was bad enough, but all three things happening together continued to stress the population. Some other social implications, if you would, we had to social distance. That was a new word, a new phrase rather, called social distance. Nobody ever heard of that concept before. We had to isolate, we had to socially distance ourselves from people we like, on purpose. I could see doing that to someone you were too fond of, but we had to on purpose stay away from people we like. And that even affected introverts. We all either, some of us are, I call myself an extroverted introvert. I can do it when I have to, but if I had my druthers, I'm off in my corner somewhere. But even affected introverts, the isolation that was required. Hotels were closed, restaurants were closed. We couldn't go to church. All of those things because of social distancing. And we were having to find other ways to, what I call, be alone together. Okay. And so we had this increased dependence on technology. Some of us, yours truly included, were dragged for kicking and screaming into the 21st century. I can do what I can do. I can do what I need to do to get my job done. But then I was forced literally to learn how to do other things, to learn how to use other technologies. I saw the inside of my laptop for the first time. I never wanted to do that. I don't want to see the inside of my laptop again, but I was forced to look at the inside of my laptop, trying to see if my 6-year-old laptop just maybe needed some more memory to get it to do what I needed it to do. Well, that wasn't the case. Okay. I never wanted to see the inside of that, and don't necessarily want to again. Zoom is a wonderful thing, Zoom is a wonderful thing. I can get dressed from, my waist up. On the bottom, I can wear my sweatpants. I can wear my basketball shorts. I could wear no pants. It doesn't matter. Okay. And so Zoom is a wonderful thing. But after a while, we have Zoom fatigue that sets in, because it's just one Zoom meeting to the other. And because there's no travel time, you don't get any breaks. You may not get any breaks in between meetings. Think about the nursing home residents who were unable to be with those who may have been able to, those relatives, those friends who were able to help them stay connected to the world. And now they're isolated because there's no visitation during Zoom. So that did something to them socially. Virtual worship services could have been very doable for some. For some, it might have been not so much. Another instance of isolation, if you're older and you don't have the technology to go to church virtually. And then now we're finding returning live. Okay. Sometimes it's like, I might rather Zoom, because if I go live now and I've got to get up, I've got to dress my entire body. I've got to spend travel time getting from one place to the other. So, all of those things go in there. We saw closure of entertainment venues. Are we showing movies again yet? The movie theaters closed down. And then, a lot of other activities were postponed also. And so I think at the end of all of this, at some level, because we were all affected at different levels in different ways by this pandemic. And again, it's not over yet. We will all have some level, I think, of post-traumatic stress disorder, simply because this was traumatic. It was traumatic when the world shut down in ways most of us, a lot of us, have never experienced till before. And so at some point, everybody will manifest some type of PTSD, maybe even years from now, because we've all been traumatized. Some handle it well, some have not handled it well. Some are wanting to go back to normal. Some are looking for a new or a different normal. I have noticed an increased number of ads on TV talking about self-care. And I do wonder if this is in response to this pandemic here. I've seen more ads encouraging people to seek mental health. Those ads where somebody, says they're in trouble of some sort, and somebody else says, well, you just need to do X, Y, and Z. And the voiceover said, well, that's not helpful. Okay, because it wasn't. The one that really stands out to me, that the weightlifter who's bench pressing, and he's got a ton of weight sitting on his chest and he can't do it, but he keeps telling the other person, I'm good, I'm okay. But it's obvious he can't lift this off of his chest. And again, the voiceover was saying, if you need help, get help. So I've seen a more of those types of ads on television. And so just a little bit about post-traumatic stress disorder. Some of the things that you might see is what they call intrusive memories of the traumatic event. Some folks may have dreams, nightmares about COVID. Some folks may do some avoiding maneuvers, avoiding places and people that may remind them of an experience they had with COVID. Going to a hospital might be a big problem for someone who had a loved one die alone in the hospital. It may be a big problem for a person who spent 2-3 months in the hospital in ICU on a ventilator. Hospital may not be their favorite place to go. They may have some negative changes in their thinking or their mood, either about themselves. We've seen people who have blamed China for the virus. We've seen people who have acted in hateful ways towards Asian Americans, but because of this, you may blame yourself if someone caught it from you, or you may blame someone else for passing it to you. Those kinds of negative thoughts may pop up. There may be some hopelessness about the future. When will this end? And the fact that someone may have contracted COVID in spite of having the vaccine. And then changes in physical and emotional reactions may be another clue that you're experiencing something, or somebody you're looking at, a loved one or a friend is experiencing post-traumatic stress disorder. They may be easily startled or frightened. They may be always on guard. They may, be continually wary of going out in public, or, challenging people to wash their hands, those kinds of things. They may have trouble sleeping, trouble concentrating, and just be plain old irritable about some things. So I think we will all have some level of PTSD as we continue on. I started to say before this is over, because I don't think it's going to be over. It will look differently. I don't know that it will always be over. So some folks are saying, I just want to get back to normal. And I just have to ask, do you really want to go back there? Because there's been some positive things also that's happened. A lot of things have been uncovered that we may not have seen had we not had this opportunity to be a part of a pandemic. So you have to ask, do you really want to go back to that normal again? Because too much has changed, and we have changed in it also. We don't necessarily need to find the new normal, but the next normal, because things are always going to be changing. And, again, just myself, I think we're going to be living with the effects of COVID-19 for some time, if not forever. I think masks and the opportunity to wear them will always be out there. I think we may be in a place where, like the flu, we will need an annual vaccination, perhaps. I don't know. I don't have an ear to anybody's keyhole, as to what's happening, either research scientifically or with the CDC. But that just seems to be that the way it's going. We don't necessarily need the new normal. Well, what is the next normal that is going to happen? And so, any positive impacts, are there any positive impacts? Again, I think we've had some really caring moments that have happened, and we may have seen things from folks that we may not have expected positively. I'm sure we saw some negative things that we would not have expected either. But we've had some really caring moments. And I think one of the biggest is we saw the scientific community rally together to get a vaccine out to the world in record time. Usually from research and development to the shelf, if you would, you're talking years before that happens. And we saw it happen in months. And so I think we were blessed to have the majority of the research and development done over the past 25 years. So that the scientists weren't starting from scratch. And I think that was probably the biggest thing that shows us we could do it if it was necessary. We have seen again, who those essential people are. And we at least appreciated them then. I think the appreciation has waned a little bit now that things are, have changed a little bit. We have seen, again, opportunities to care for one another. We've had more information. We've had more conversations. I think that even though this has been a bad place for us to be, we've also had some positive impacts, some positive outcomes from this also. So this is where I was going to end and ask if there were any questions out there or any comments, any experiences that anyone wanted to share as far as an impact COVID may have had on them or someone around them, or just any questions that I may or may not be able to answer.
So one of the things that I'll just note really quick that I had the opportunity to research in part of my studies was how we desperately need technology infrastructure, specifically at all college campuses. And it really highlighted, COVID really highlighted all of the inequities within certain groups who didn't have access to internet. And I think a lot of educators really were able to develop a new level of empathy for people who were going to Walmart parking lots and turning in, assignments on their cell phones, which still causes me a lot of anxiety thinking about, working just from my phone. But we desperately need to move to, quote unquote, this new normal where students are continuously wanting more hybrid models. So there is still that option where you can wear the sweatpants and be on Zoom, or you can be in person. So I wanted to point that out.
That kind of hit home with me also, when the 3 students who dropped out. They were all students of color, who literally said, I don't have any place to be in class in where I'm going back home to. Students who always borrowed a laptop to take their exams from, and students, even if they had a place to be, just really did not have internet. And then another class, in teaching another class, you got 2 students who are trying to use the same internet to take class at the same. Well, that everybody's going to take turns dropping out. Giving exams was horrendous. That was anxiety producing for me as an instructor, because I knew there were going to be issues, people getting kicked off and having to restart them. And I just never imagined.
Georgita, thank you so much for today. Near the end here, you talked about new normal or next normal. And I think for me, the word next normal is such a powerful word for me, next normal, because it reinforces that change is always taking place. So I love saying, okay, the next normal. So thank you for that.
I wish I could take credit for that, but I don't remember where I got it from, but I do like it also. And it's just like you said. I saw a picture one time that said change used to look like a stair step. You had a chance to get used to something before something else changed. Now change is a slope. Because it's constant.
It's so inevitable, and people fight it or embrace it, everywhere in between. So
and it's going to happen anyway, whether you fight it or not.
Exactly. Another thing I was thinking about is, in all of this, one of the things, like me personally, through a lot of my life, I never asked for help. And do you think that this pandemic has increased people's willingness to ask for help? We tend to be a prideful people.
And it's hard to ask for some people, and it's hard to accept help for some people. And I think that may have been tempered a little bit for, again, just like everything else, more for some than for others, that at some point we all need help, and we all need to be able to accept help from wherever it comes from. That not doing so only hurts me. If I'm the one I don't need it, only hurts me. And it gives somebody else a sense of well-being to be able to help somebody else. So sometimes you might need to accept it, not for you, but for them.
Right.
Just for them.
It's like asking, some people say, well, this might be a stupid question. I want to say, no question is stupid. But there's so many people sitting in that classroom that are just afraid to raise their hand and ask what they believe to be the stupid question. And with all this heightened awareness to mental health, I just hope people are more encouraged to reach out for help because of, again, maybe that's one of the purposes of this pandemic.
And
right?
I think people maybe, because again, I'm noticing an increase in those kinds of ads on TV. And you have to understand, I don't sit and watch TV. I use TV as a radio with pictures. Okay. I'm usually doing something else. So when these ads catch my attention, they've done something. Okay, because I'm not paying attention to you in the first place. So when the ads catch my attention, that is something. So I'm noticing this increase in these kinds of ads, and maybe some psychoanalyst out there has taken this opportunity to do that. You're going to need help, so ask for it. And if you're going to give help, do so appropriately. Because those commercials that end up with, that's not helpful, well, don't say that. So I think you may have a few more people who are willing to ask for it, simply because everybody's been through this has been traumatic for everybody, Yeah.
Well, thank you, Dr. Washington, for sharing with us today. It was so engaging and good to see some of the new people who showed up. Join us again on Tuesday, August 9th. We will be with Sean Hemrick. He will be facilitating a discussion on racial battle fatigue and Black male students. So looking forward to seeing you on August 9th. Y'all have a wonderful day.